Hello there, I'm Kate Mars from the Mind Body Reset, and I'm here today to talk to you about PTSD and trauma. Now, post-traumatic stress disorder, also known as PTSD, is a mental health condition that's caused by an extremely stressful or terrifying event, whether encountered or witnessed. But whilst it's a fact that everyone who suffers from PTSD has experienced trauma, not everyone who's been traumatized will develop PTSD. However, most people who are subjected to traumatic events have a difficult time adjusting to and coping with the fallout of initially. With time, though, and by focusing on self-care and self-help, things usually improve, albeit gradually. If, however, the symptoms get worse, linger for months or even years, and affect the individual's ability to function, particularly on a recurrent or near daily basis, then they may well have PTSD. So getting treatment after traumatic events occur, such as serious road traffic accidents, violent personal assaults, serious health problems and distressing childbirth events, as well as combat experiences, especially where PTSD symptoms arise, is imperative to promote healing in the short, medium and long term. Now, the symptoms of PTSD include flashbacks, nightmares, severe anxiety and uncontrollable thoughts about the event, which usually start within the first 3 months after a traumatic episode. However, in some cases, symptoms may not appear until years later, possibly as a consequence of further traumatic occurrences, creating a layering effect on top of the original incident, or an additional isolated, often seemingly insignificant event which echoes the original trauma. PTSD symptoms are generally considered to last more than 1 month and cause major problems in social or work situations, as well as affecting how the sufferer gets along with others or their ability to undertake their daily tasks. PTSD symptoms are medically grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Symptoms can, however, vary over time or from person to person. Intrusive memory symptoms include unwanted, distressing recollections that occur, reliving a traumatic event as if it were happening in the present, also known as flashbacks, upsetting nightmares about past events, severe emotional or physical distress due to something that reminds the sufferer of the trauma. Avoidance symptoms may include trying not to talk or even think about the events, and staying away from places, activities or people that are reminiscent of the trauma. Negative changes in thinking and mood. Symptoms may include negative thoughts about oneself or others, ongoing emotions of fear, blame, guilt, anger or shame, memory concerns, including not remembering significant aspects of the traumatic events, feeling detached from family and friends, not being interested in activities once enjoyed, having a hard time feeling positive even when good or great things happen, and feeling emotionally numb. Changes in physical and emotional reactions. Symptoms may include being easily startled or frightened, always being on high alert to danger, self-destructive behaviour such as drinking too much or driving too fast, having trouble sleeping or concentrating, feeling irritable or being prone to angry or aggressive outbursts, and excessive sweating, rapid breathing, fast heartbeat, or physically shaking. Over time, PTSD symptoms can vary in severity. People often experience more frequent or intense PTSD symptoms during periods of stress or when circumstances are similar to that of the trauma, including approaching the same time of year as when the event happened, hearing a car backfire, then reliving a prior experience, or seeing a report on the news about an assault and feeling overcome by your own traumatic memories. Do talk to your healthcare provider or mental health professional if you have disturbing thoughts and feelings about an event or events for more than a month, especially if they're severe or if you're having trouble getting your life back on track. Getting treatment as soon as possible can help prevent PTSD from worsening. Treatment options depend on the severity of the symptoms and how soon they occur after the event, but watchful waiting to monitor symptoms, antidepressants and talking therapy such as trauma-focused CBT or eye movement desensitization and reprocessing known as EMDR may be recommended. However, if you have even occasional suicidal thoughts, then please get help right away by calling 999 or 111 phoning the Samaritan's Child Line SOS, or texting shout to 85258. And if you're having lower grade symptoms and want to refer yourself privately, then do consider Sentimentology, a blend of hypnotherapy, guided visualization and interactive lucid dreaming, as it's a great way to non-traumatically clear your emotional clutter and start the process of setting you free from the limitations that your past is imposing on your present life. And if you're interested in how the Mind Body Reset could help you tackle your health concerns, please DM me to ask a question or join my Facebook community, the Mind Body Reset group for busy women. Thank you for watching. I hope you found that helpful. Goodbye.